CBD is a big buzzword in health circles these days, and survey data indicate that people are using it for a variety of issues, including mental health. But how much do we really know about CBD and mental health? That's the topic of this week's Healthcare Triage. Cannabidiol, or CBD, is one of the most well-known components of marijuana and is not psychoactive like its THC counterpart. It has been touted as a treatment for almost any mental health condition you can think of, but the overall evidence for this in humans is pretty scant. Beyond that, the evidence we do have suggests that effects are isolated to doses far higher than that seen in commercial products. But to the research! A systematic review and meta-analysis published towards the end of 2019 was only able to find a small handful of studies examining the effects of pharmaceutical-grade CBD on mental health, and the majority of the evidence was rated as low quality. The authors were unable to find any RCTs in the effect of CBD on depression, ADHD, Tourette syndrome, or PTSD. They did include 2 studies on CBD and anxiety, finding no reduction of symptoms in individuals with an anxiety disorder. In the realm of mental health, the bulk of CBD work has been conducted in relation to anxiety, and there is a small, but not robust, amount of evidence in favor of an effect. In a 2017 study, a total of 60 participants were randomly assigned to either placebo, the anxiety medication clonazepam, or one of 3 doses of CBD, 100, 300, or 900 milligrams. Anxiety was then induced via a public speaking task, and subjective and objective measures of anxiety were taken at baseline, before, during, and after the speech. Subjective anxiety scores, as well as heart rate and blood pressure, were all increased by the public speaking task. Compared to placebo, the clonazepam group had lower subjective anxiety scores during and after the speech, and the same was true for the 300 milligram CBD group, but only after the speech. This has led some scientists to conclude that CBD dosing may be subject to what we call the inverted U-shaped dose effect curve, or what some researchers like to call the Goldilocks effect. Too little or too much, in this case the 100 or 900 milligram doses, doesn't show an effect. But somewhere in the middle, in this case the 300 milligram dose, is just right. While that could definitely be the case, we think these results suggest that we need more studies with way more participants to understand what it all means. Besides there only being around 12 people per group, there's a lot left to speculate about here. CBD, even at the Goldilocks dose, didn't alleviate self-reported anxiety before or during the speech. And unlike clonazepam, it didn't alleviate objective measures of anxiety like increased blood pressure. There are a few similar human studies, but with many of the same caveats, and many don't include a plasma measure. This is a big one because it tells us how much of the drug entered circulation and was thus able to have an active effect. CBD has pretty low bioavailability, especially when taken by mouth, meaning very little of what you take actually ends up being able to do anything. So now coming back to that meta-analysis we started with, it did report evidence that a 1,000 milligram dose of CBD helped to alleviate some, but not all, symptoms of schizophrenia when taken alongside existing antipsychotic medication. However, a very similar trial found no effect at a dose of 600 milligrams. Looking at the effect of CBD alone, a 2012 randomized controlled trial compared outcomes between schizophrenic patients taking CBD or amisulpride, a medication commonly used to treat schizophrenia, finding that treatment with 800 milligrams of CBD led to the same improvements as amisulpride, but with fewer side effects. This is great, but the trial is far too small, only a total of 42 patients to draw any grand inferences. So the data we have in humans so far is mixed, and though it appears to lean in the direction of little to no effect of CBD on mental health, most of it is pretty low quality, so we're in no shape to come down on either side. Also note that a 300 milligram dose of CBD, the lowest amount shown to be effective in studies with positive results, can be hard to come by in a commercial product. For example, a bottle of gummies may list 500 milligrams of CBD, but this is per bottle. So a bottle of 50 gummies gets you 10 milligrams per gummy, meaning you have to eat 30 gummies in one sitting to get a possibly effective dose, giving you less than 2 doses per bottle. For CBD oil, a 1,000 milligram bottle containing 50 milliliters translates to 20 milligrams of CBD per milliliter, so you'd need 15 milliliters for a 300 milligram dose, meaning that bottle would only provide you around 3 doses. This can get pretty expensive pretty quickly. And that's assuming you're actually getting the amount of CBD listed on the label. On occasions where the FDA has had reason to test the chemical content of these products, they've often found that many do not contain the level of CBD being claimed on the label. And of course, the amount of CBD absorbed by your body may vary based on many factors like diet and the form in which the drug is administered. Beyond this, because these products aren't generally regulated by the FDA, some can contain a fair amount of THC or even other contaminants, making it hard to know where any perceived effects could be coming from. But a lot of people insist that these products make a big difference. While we can't say for sure, it is reasonable to suggest that some of it might be placebo effect. A study published this year found that participants who were given CBD-free oil but told they were being given CBD showed improvements in heart rate variability and subjective sedation. And in participants with previously held beliefs about CBD being effective for anxiety, self-reported anxiety was significantly lower. The trial was small, it didn't have a CBD condition for comparison, but there you have it. We certainly aren't against any placebo effect that makes someone feel better, but we do recommend talking to your doctor about taking CBD, especially if you're taking other medications, because evidence suggests that it can inhibit some drug metabolizing enzymes. This could mean that, like grapefruit and St. John's wort, it might be dangerous in combination with certain drugs. So that's where we're at with the data on CBD and mental health. Join us next week for a look at the data on CBD and other ailments, including seizures, pain, addiction, and sleep issues. Hey, did you enjoy this episode? You might enjoy this previous episode on National Month of Action to increase COVID vaccinations. We'd appreciate it if you consider liking and subscribing down below and going on over to patreon.com/healthcaretriage, where you can help support the show and make it bigger and better, even during a global pandemic. We'd like to thank our research associates, James Glasgow, Joe Sevitz, Josh Gister, and Michael Chin, and of course, our Surgeon Admiral, Sam.